All right, I will let our presenter take over.
Okay, well, let me get started then. My name is Annette LaGreca, and I'm a professor at the University of Miami in Coral Gables, Florida. And by training, a clinical child psychologist and a clinical researcher. And I've been studying children in disasters for the past 30 years. So I'm going to share with you some information that we've gleaned from my research and research of others in the field. And I'm going to be joined today by Scott. Scott, maybe you want to introduce yourself?
Sure. Good morning, everyone. Nice to be here and appreciate y'all taking time to join us today. So my name is Scott Seven. I am president of Serendipity. We are a consulting entity out of Miami, Florida, and we specialize in capacity building initiatives. So we do large scale initiatives across the US and internationally, generally supporting and enhancing education and human services. Annette and I actually go way back. We've done a lot of disaster mental health programs, starting with 9/11, all the way through most recently supporting the terrible floods in Hill Country of Texas. And happy to be here and answer any questions as we go along. So, Annette, all you.
Okay, well, let's get rocking and rolling here. I'm going to shift over to my PowerPoint slides and get started. Okay. So as I said, I'm a professor at the University of Miami, and you'll notice here in a couple of places on the slides, I have links to both my lab and to Serendipity, where you can get some additional information and follow up from today. But for personally, I became interested in disasters when I first experienced one, Hurricane Andrew in the Miami area. This is now more than 30 years ago. And since that time, and that was a very devastating Category 5 hurricane. Since that time, I've come to study and participate in recovery for a number of other key disasters like Hurricane Charlie in 2004 in the southwestern part of Florida and Hurricane Ike. Um, Hold on, let me just get rid of this little arrow here. Okay, Hurricane Ike, which hit the Galveston area in 2008, and Katrina and others since then time. But what I want to point out here is that apparently destructive um, climate disasters are on the rise in the U.S. This is just data from last year for the billion-dollar weather and climate-related disasters. And last year was a year where we didn't even have any hurricanes, but you can see that there's a large number of storms and tornadoes that affect particularly the central part of the U.S. that have been very devastating over the past year. And unfortunately, these events are becoming more severe and more common. And if you look at Kentucky alone, just data available from FEMA show that for the 20-year period preceding 2000, Kentucky was affected by 20 different destructive billion-dollar disasters. And then that's tripled almost in the 20 years since 2000. And the areas that seem to be particularly affected have been the eastern part of the state. This is probably in part a result of the shifting tornado alley that we see. So, Tornado Alley, the area in the US that has the most tornadoes, has shifted from 1950 to 1984 was more central US and now has shifted further east and covers parts of Kentucky. So, with that in mind, I'm going to today focus on these key points. First, what is a disaster? What do we constitute a disaster, a traumatic event? And then, more importantly, what are the lessons we've learned from studying them over the years, particularly in terms of youth reactions, mental health reactions, and what are risk and resilience factors that can help promote children's safe recovery after a disaster? And then finally, I'm going to spend a bulk of time on the implications for intervention and building resilience. So briefly, just in terms of what we consider to be a disaster or traumatic event, it's characterized by first feeling that one's personal safety or that of the love of your loved ones is threatened. So they're scary and also frightening and outside the realm of usual experiences. But one of the things that didn't I wasn't aware of until I experienced a disaster myself was how much they disrupt everyday life, both in the short term and often in the long term. And as an illustration of that, I have a picture of a child on the U.S. Gulf Coast that was taken 1 year after Hurricane Katrina. This wasn't even in the New Orleans area. And you can see this child's life did not go back to normal for a long while after the hurricane. This is a year after, and his neighborhood was still in disarray. So let's turn to some of the lessons that we've learned from studying youth reactions. The first thing I'd like to point out is that post-traumatic stress is now the most commonly studied reaction among youth. And in case you're not familiar with the symptoms of post-traumatic stress, hold on. I've got a little glitch here. Okay. Sorry for that. The symptoms are in four different categories. The first and most commonly thought of ones are re-experiencing the event, feeling like from having bad dreams or intrusive thoughts where you can't stop thinking about the event. Second set of symptoms involve avoidance, avoiding anything that reminds you of the disaster. And it can be avoiding external cues like places or activities that remind you. Like we had one child who, after Andrew, wouldn't go into his living room because it reminded him of how his living room was destroyed during the storm. Arousal is another set of symptoms, and that is reflected in things like hypervigilance, insomnia, trouble sleeping, poor concentration. I've underlined these because these symptoms in particular make it very hard for youth to concentrate and do well in school in the aftermath of traumatic events. And then finally, the last group of symptoms have to do with the way you think and feel, cognition and mood. And these we observe most especially in teens and adults, but it may include things like negative beliefs about the future, feeling that anhedonia, like a lack of feeling, either positive or negative feelings, and our excessive risk-taking behaviors. And for a diagnosis of post-traumatic stress disorder, all four symptoms clusters have to be present for at least a month. If they're a shorter duration or fewer symptoms, then it would be considered acute stress. But the second point I'd like to make is that post-traumatic stress is not the only reaction observed among youth. We do find over my studies and others that there are many symptoms of psychological distress. So it may be acute stress, post-traumatic stress, anxiety, and depression are the most common psychological distress symptoms you see. In addition to that, though, there can be grief can be present, especially if there's been loss of life in the disaster. For adolescents and adults, an increase in substance use is common. Also, in adolescents and adults, you can see evidence of suicide or suicide thoughts, suicide ideation. And then lastly, among children and adults, there can be stress-related health problems. The most prominent ones seem to be loss of sleep and somatic symptoms. So the third point I want to say is that many youth report multiple mental health issues. So it's not just post-traumatic stress or anxiety or depression. For example, after Hurricane Michael, 6 months after that disaster, we assessed youth in the public schools, and this pie chart represents the percentage of youth, all the youth who reported clinically elevated symptoms of post-traumatic stress. And you can see that of this pie chart, 25% or a quarter of the youth also reported significant elevations in depression, and more than half the sample reported significant elevations in anxiety and depression and post-traumatic stress. So multiple kinds of psychological reactions are more than the norm rather than the exception. The fourth point I'd like to make is that disasters also affect youth's physical health. And this makes sense because stress plays a role in disease development and immune suppression. It also can disrupt one's daily diet, your exercise, and your daily routine, and that can also be a risk factor for health issues. For example, after Hurricane Ike, we took a look at how stressors and post-traumatic stress symptoms were related to youth's health risk behaviors, finding that the recovery stressors led to problems with post-traumatic stress symptoms, and that in turn affected. Are you seeing this little blurb here? Hold on a second. I'm trying to get this off my screen. Here we go. Anyway, it affected their sedentary behavior. So kids became more sedentary after that storm. And other studies have shown problems with insomnia and physical somatic complaints like stomach aches, headaches, and those kinds of somatic symptoms. Sorry, I don't know what's going on here with this. I'm losing. Here we go. Okay. Fifth point I'd like to make is disasters also affect youth more than adults realize. In our work and other work, we find that parents' reports of children's post-traumatic stress are essentially unrelated to the child's own reports of post-traumatic stress. So we take this to indicate that adults are often unaware of how many symptoms children are experiencing or how distressed they are. This is probably in part because children see that their parents or adults are distressed and try to keep some of their feelings to themselves. And this also may be the case because adults may be unaware of what symptoms are important to look for in youth. So, in summary, for this first section on mental health outcomes, we would recommend that if mental health assessments are conducted, they should evaluate or ask youth directly how they're feeling. And it should assess mental health reactions broadly, not just post-traumatic stress. And that also take into account that adults are also stressed, and adult self-support and self-care will be important going forward. I don't know. We have time for a quick question or two if there's a question. I don't know if there's anything, and feel free to add questions in the chat as we go along, and Scott will try and monitor them as we get to little breaks. Um, but let me move on, and we can take questions at the next brief break. So now I'm going to turn to lessons learned about risk and resilience. So we know that there are these mental health and even physical health outcomes. How do we know who's most at risk and who is going to be most resilient? And how can we use that information to promote better interventions post-disaster? So the first piece of news, which is good news, is that most youth are resilient and do recover over time. And I'm going to illustrate this in this figure that George Bonanno developed to describe what are the trajectories or patterns of recovery after disasters. And you'll see the dark blue line at the top shows individuals who are severely impacted initially and remain chronically distressed. The green trajectory shows you individuals who are initially distressed but who recover over time. And the light blue graph at the bottom or trajectory at the bottom shows you individuals who either have minimal reactions or who might not have been directly impacted by the events. And those are considered resilient individuals. The one trajectory without any color on it is a delayed trajectory where an individual might not show much distress initially, but it increases over time. We find that's not a typical trajectory for youth. It's a more typical trajectory for adults who are um, who are first responders and who have to kind of keep things together initially during the reaction and recovery period, but who later then go on to show problems. But it's not very typical of youth. So, for example, we looked at these trajectories in our sample of youth after Hurricane Andrew, and you can see that 43% were in the recovering trajectory and 37% in the resilient trajectory. So 80% of the youth were either okay or recovering after the event. And if you look at those who initially started off elevated, the chronic and the recovering youth, you'll see that 2 out of every 3 of the elevated youth did also recover over time. So the typical pattern is to improve and get better over time. So the next point I want to make is that early risk factors do predict which youth recover versus those who remain distressed. We're interested in separating out the recovering youth from those who are chronically distressed so that the chronically distressed youth can get help that they need. So to do this, we've used this risk and resilience model to understand what factors contribute to stress reactions. And I'm going to walk you through the 3 key components of this because they have implications for what to do with kids post-disaster. The first component is pre-disaster characteristics, or what the child was like even before the disaster occurred. And here there are a number of factors that play a role in how children do over time. So the kids who are seem to be most at risk for adverse reactions tend to be girls rather than boys in terms of post-traumatic stress, younger children rather than older children, kids who already had problems functioning before the storm or before the event, such as kids who were anxious or depressed, kids who had special needs, like kids with learning problems or autism or other neuroatypical problems, um, kids who've had other prior trauma exposure. The literature shows that children from low economic circumstances and many minority youth who are in low economic circumstances may also have a harder time recovering, as well as individuals with certain genetic markers or who are more biologically reactive to events. Now, these pre-disaster characteristics typically are things you can't modify or change, but they can indicate what populations may be more vulnerable. So if you're working with youth in the community and you're working with individuals who are in a low socioeconomic area, minority area, if you're working with youth who have special needs, you should know that those youth are more vulnerable when these kinds of events occur. So that's the first component of the model. The second component of this risk and resilience model is exposure to the disaster. What kind of exposure did the individuals have? And exposure can put both youth and parents at risk. Now, exposure can take place in terms of, we characterize it in terms of life threat, whether you feel your life was threatened during the event, and what kind of loss and disruption ensued after the event. So, in terms of life threat, it's mainly the perception that your life is in danger that seems to be critically important. And this can happen even if no one is actually hurt or harmed. So for example, if you're in the tornado basement waiting out a tornado and you could hear like things above you rattling, rolling around, things home potentially being destroyed or damaged, you can feel that your life is threatened even though there is no loss of life. But other ways, if you do see injury or harm to yourself or a loved one or the death of a loved one, that also strongly contributes to perceptions of life threat. I mean, and this is just an illustration that loss of life is not necessary to perceive that your life is threatened. And this was pretty obvious, for example, during the COVID pandemic, where there were many, many lost lives, even though, and you might perceive that your life was in danger too, even though you may not have lost any close friends or family members to the pandemic. And one other point I'd like to make about life threat is that you can perceive your life is threatened even before a disaster strikes. And this was true. The media often hypes events before they occur. Like this was some media coverage of Hurricane Irma before it struck Florida. You can often, before wildfires, see large numbers of people evacuating in anticipation of a fire in their neighborhood. And also with tornadoes, a lot of the preparation and taking shelter can also be very anxiety provoking and increased threats, perceptions of life threat. The second aspect of exposure is with the loss and disruption that occurs in the immediate aftermath and that may go on for a while after the event occurs. So the event isn't over once the tornado, flood, or hurricane is gone. So this is some of the ways in which children expressed their loss and disruption after Hurricane Andrew. We found in the 3 to 7 months after the storm, 61% of the youth had their homes were badly damaged or destroyed, their clothes were ruined, and so on. In particular, many of them had to move to a new home and change schools. And moving and changing schools happens to be one of the most significant stressors youth in general experience during childhood. And so these are the kinds of things that contribute to stress reactions. Here's a couple of examples in children's own words. So, for example, after Hurricane Andrew, we asked youth, what were the worst things that happened to you because of the hurricane? And just for a couple of examples, if you look at the first child, he or she said, I had to move away. My uncle lost his house. My turtle died of a heart attack. Many kids lost their pets, and that is also very devastating to youth. Or look at number 3, the third child, that I lost everything, that we lost our home, and that we had to leave my mom and dad about 3 or 4 months. These kinds of things often separate families because the home is damaged and or the school is damaged and it's not safe for children or able for children to remain at home. So now the third part of this overall picture is what happens during the recovery process. And that's what's especially important for youth reactions and also is the area where coordinators and others providing support for children can really be extremely helpful. So in this last part of the risk and resilience model, you'll see how the family's functioning, the kinds of life events that occur, the availability of social support, and how a child is coping with an event are all critical in terms of understanding children's stress reactions. So let's just briefly take this one by one. So first, after the event, how the family is functioning is critically important. If the family is doing well, if their parents or caregivers are handling the situation well, if there's a lot of family cohesion, that's good for children and it prevents them from becoming too stressed out. On the other hand, if family functioning is not going well, that can be an acute stressor for youth. So if there's a lot of family conflict, if the parent or caregiver have a lot of mental health concerns, that's also not so good for the youth. In terms, life events is another key variable here. Just because you've had a disaster doesn't mean that there aren't other major life events that could occur that might be or might not be related to the disaster. For example, parents sometimes separate or divorce. There might be an illness or death in the family. Again, it could be unrelated to the disaster, but it's an additional stressor on a youth who's already stressed because of what's going on with the disaster. And so the major life events that occur in the aftermath also challenge kids' coping skills. The third main after the event variable that's critically important is the availability of social support. Um, when social support, that's probably the most key thing you can do to help youth recover, is provide sources of support and help them access sources of support. And sources of support can come from family, from the kids' friends and classmates, teachers in schools, and you like adults in the community that youth interact with. All of these sources of support can help kids cope, but unfortunately, disasters often reduce social support from youth's network because the others are also affected by the disaster. So anything you can do to help build support in the aftermath of disasters is going to be very helpful to youth. And then finally, in the aftermath, the other thing that we look at is how is the youth coping with what's going on. There are positive ways to cope. For example, if youth can regulate their emotions by remaining calm, not being aggressive, seeking support, problem solving, those are positive ways of coping with the stressors that are occurring. On the other hand, research consistently shows that coping strategies that reflect poor emotion regulation, things like acting out, yelling, taking it out on others, blaming yourself, or being very irritable, those not only do not help kids recover, but they often make the situation worse. And so, one of the things you can do is kind of steer kids in the right direction in terms of ways to cope after an event like this. So, in general, to sum up the risk and resilience aspect, what's really important for you and individuals in the community to do after a disaster to build youth resilience is to promote resilience by building social support and social connections, helping youth improve their strategies for coping with stress, helping youth regulate their feelings of anxiety, depression, and stress, and also to support positive family functioning and cohesion. So, and I'm going to briefly pause again here too. Any questions? I don't know, Scott, if there are any that you see in the chat. No, I don't.
I don't see any in the chat, but I just want to just mention that the same strategies that you're talking about for helping youth will also help adults after the disaster as well.
Yeah, absolutely, and especially the social support. All right, so let's turn then to more of the intervention here. Um, So what are the implications for intervention and for building resilience? Well, let's start with a timeline, a disaster timeline. Typically, and what you do depends on where you are on this timeline. So at the beginning of the timeline, you've got the impact of the event, whether it's a hurricane, flood, tornado. That's time zero, shall we say. And in the immediate aftermath, the thing that becomes most critical is helping children and families, adults, feel safe, secure, and trying to normalize their everyday, day-to-day existence in whatever way you can. But then once that's settled, you start to get into the recovery period. And that's where psychoeducational materials, distributing helpful information like Youth Strong or other materials to interested parties, youth and adults, can be very helpful. Also, what we call watchful waiting, which means seeing how kids are doing, helping them cope, but also being on the lookout for kids who are having more trouble adjusting or managing their feelings and emotions. And for those youth, maybe selected interventions could be useful, which I'll talk about briefly. And then once you get to the point where it's 9 to 10 months or close to a year after the event, that's what we would call the late recovery period. Um, if youth who are still distressed or adults who are still distressed are going to need more intensive interventions, more likely one-on-one kinds of help from mental health professionals. So, like with this timeline in mind, I'm going to organize the interventions. I'm going to spend most of my time on what's here is called Tier 1, which are universal interventions, things that help most kids or even adults recover in the aftermath of these events. And here's where Youth Strong and other materials, similar materials like psychological first aid, could play a role. And then you move on to Tier 2, which are things that are selectively used for those who are not recovering or showing signs of distress. And again, there are some materials in Youth Strong that can help with that. Also, there's another Skills for Psychological Recovery program that can help with that as well. And then finally, when you get to level 3 or tier 3, those are where at the more selected indicated interventions for those who haven't recovered or who have chronic problems. And I'll walk you through those three phases, but with the emphasis on level 1 or tier 1, because that's where I think most of you can have the biggest impact. Let me just mention a couple of things in terms of at least my understanding of how coordinators can support disaster mental health. One of them is just by your awareness and education, so you can provide accurate and needed information, psychoeducation to those who might be affected. And just also helping to reverse the stigma of seeking and receiving help. Some of you may also be involved in programming, so in teaching some skills and strategies that can foster resilience and coping, such as the activities that we have in the Youth Strong book, and providing specialized support to at-risk individuals and communities. I think many of you also may be involved in partnership networks and trying to bring partners together to solve and identify challenges. And then finally, and especially for those who with the more chronic problems, helping people access resources that need them and maintaining an accurate and up-to-date information on providers and resources. I don't know, Scott, is there anything more you want to comment on or say here before we get into the nitty-gritty of the manual?
I think the real key piece to the referral piece is when a disaster strikes a community, when a large scale disaster strikes, a lot of providers tend to lose services, they tend to lose staff. And so information that you had on services prior to a disaster needs to be updated as soon as possible after the disaster, and then keep having that information flow in as time goes on because things change quite a bit. New services come online quite frequently after for mental health services. Sometimes we see that, a few months afterward, but that's really an important part to it.
Okay, thanks. So let's start with level 1 or tier 1 universal interventions. These are interventions that really attend to the child or adult's immediate needs for safety and security, providing psychoeducational materials to help normalize their day-to-day existence and helping them cope with stress. Then again, promoting social support and social connection, and also providing care for the caregivers. It's sort of like the analogy you see on an airplane safety to put your oxygen mask on the parents before you put it on the child. The people providing care also need to take care of themselves and be able to help you. So, in this regard, you'll find the Youth Strong Manual, I think, hopefully very helpful both for levels one and levels two of types of interventions. It's a guide to help youth and families in times of disaster and stress. And if you lose track of your own copy, you can always download a copy from my faculty website, which is listed here, or from the Serendipity website. You also may be interested in following us on Facebook or Instagram because we post things fairly regularly in user-friendly ways that help adults help youth in the aftermath of disasters. But we've now distributed this, and earlier versions of our manuals have now been distributed to over 40 million people nationally and worldwide. And as Scott mentioned most recently, to help with the floods from in Texas last July. If you're using the Youth Strong book, just a few quick tips. Really take a look through the book first. You'll notice that there are activities for adults on the left pages and often youth activities on the right page, and there are little logos to suggest an adult and a youth page. Before you use it, we would suggest you evaluate your own stress level first. And if you are stressed, to talk to other adults or take care of yourself before trying to do some of the activities with youth. And then I would recommend that you select activities that you think would be most helpful for the youth you're working with. You can choose from, and I'll show you in the next slide, a list of things that help most youth. And then you can use the special situations in the manual as the need arises. So, for example, the things that will help most youth, these are the activities in the manual that you really want to focus on. How to talk to youth, how to promote social connections and support, how to promote positive coping, maintaining normal routines, helping youth stay healthy and fit, reducing their media exposure, which can increase their stress levels, maintaining a positive outlook, encouraging relaxation. We're going to go through just a few brief examples of these, not all of them, just a few select ones that I think are worth starting with. The first thing I would say, there are tips there for talking with youth. Many of you, if you've been in a counseling situation before, you may know these things already, but what we recommend in general is to listen to what youth have to say because it's a way of showing support, to acknowledge and normalize their statements. So like, it sounds like you were scared. A lot of people felt that way. Try to remain neutral and acknowledge when you don't know the answer to something. It's also okay to express your own feelings, but try to do it carefully. And also pay attention to behaviors that show, especially nonverbal behaviors that show youth have strong feelings like fidgeting, squirming, poor eye contact, and so on. So those are just some general tips. But then here's just one of the highlights of the lesson on staying connected and supported. Because social support is critical for stress management, but also youth social support networks are typically disrupted because of the disaster. It's important to try and find ways to connect youth with those who can support them. And here's an example of the youth activity we have in Youth Strong. So it's basically the people in my life circle. And basically, what you do if you're working with an individual child or a group of children, you have them put themselves in the middle of the target, in the bullseye of the target, and then identify the important people in their life, that family members, friends, pets, teachers, people that are important to them, and put those that they feel closest to in the circles nearest them, and then going further out. And then after they get a chance to complete the circle, there is an activity that asks them to answer these questions about the people in their life. So, like, who on that chart, who can you talk to about your feelings? Or who gives you advice or helps with problems? And so on. Who helps you feel better when you're down? And once they identify those people, then there's another chart that helps them figure out how are they going to stay in contact with those people on a daily basis, weekly basis, monthly basis, so that they have a social support plan going forward. Another topic is keeping a routine. And the reason for this is because disasters and other stresses really disrupt everyday life, but yet youth and adults feel more in control when they have a predictable routine. And so there's a youth activity that helps youth with an adult for guidance, identify what their regular routine is. So they go through the day, their morning, afternoon, evening, bedtime. What do they typically do? And what time do they typically do that? And if they're not able to maintain that routine, what can they do in their new routine to make things make sure to include times for meals, schoolwork, having fun, relaxing, talking to friends. They may need to have a new routine because they can't do things exactly as they did before. And this is an exercise you can revisit periodically when there are a lot of disruptions to a child's life or routine, like if they have to change schools or if they have to move, for example. Another exercise in the Youth Strong book is on staying positive and giving thanks. And we include this because evidence indicates that giving thanks and expressing gratitude are both lead to positive emotions, and they also reduce anxiety, stress, and depression in youth and in adults. And so this is an opportunity for adults to model and encourage youth to engage in such activities. So there's a youth activity here, staying positive and giving thanks. And basically, it's sort of like journaling. And I think adolescents, teenagers especially like to do this in a journal. But the idea is that every day they identify something that positive that happened to them or their family. And it could be anything like a sunset or eating a favorite meal or visiting a friend. But to take the time at the end of the day, perhaps, to focus on at least one positive thing that happened to you that day. Another kind of activity that's in that part of the manual for youth is giving thanks to others. And so again, it can be a daily activity where the youth identifies someone that they're thankful for and why they're thankful for it. And it's even better if they share their thanks by telling that person directly or even writing them a thank you note. But this gets youth to focus on positive things that are occurring in their life, and it is extremely helpful in reducing stress. And then finally, the last exercise I'd like to pull out of the manual is called staying relaxed or trying to keep relaxed. And the reason for that is because relaxation calms your emotions and helps you think more clearly. And that in that way, it should enable you to problem solve more effectively. And relaxation is great, but this is something adults can also model and practice with youth because it takes practice to be really good at relaxation. There are a couple of interesting activities in here for youth. The one that I particularly like is the pizza breathing, which is really an exercise in deep breathing to help you relax. And the idea of it is that especially if you like pizza, but if not, something else like hot chocolate or something else that you really like, but you kind of close your eyes and envision the pizza in front of you, and you slowly breathe in as you're smelling that pizza and enjoying how good it smells. And then hold your breath for a while, and then you start blowing on the pizza. Exhale to blow it out and cool it off to make it so it's not too hot to eat. And you kind of repeat that a few times until you feel calmer and more in control. So, I mean, that kind of sums up what I'm going to want to say about the level one interventions. But these are the parts of the Youth Strong Manual that are designed to help most kids recover. And those are things you can do with kids at any time, and even before a disaster occurs and in preparation, because they're great for stress management. Now, I want to talk briefly about level 2 and 3 before we close up. But level 2 interventions, again, are those who focus on those who are not starting to show signs that they're not recovering well. They're anxious, they're depressed, they may be angry and irritable. The common issues you see here are some kids will have a lot of fears and worries. Others will be very sad and despondent. Some kids have a lot of intrusive thoughts about the disaster that interfere with their day-to-day functioning or may interfere with their sleep. Other kids get very angry and irritable. If that's the case, then the possible solutions involved, one would be if you're working with schools, there are school-based interventions One is called CBITS. That can be done with school groups or school counselors. Support groups can also be helpful. And also, there are lessons in the Youth Strong Manual around some of these things, fears and worries, sadness and loss, etc., that can be done either on an individual or a group basis for the kids who are not recovering that well. And then finally, we've got the level 3 interventions, or the tier 3, whatever, at the top of the pyramid for youth who have chronic problems and who are not recovering over time. And for these youth, referral to a mental health professional is probably the best course of action, or a school counselor who can deal with individual assistance. The interventions that are available, evidence-based interventions that are available for chronic distress, um, include trauma-focused cognitive behavior therapy, which may be the first line of intervention is considered to be the first line of intervention for those with chronic post-traumatic stress and other distress symptoms. Sometimes even additional strategies may be needed if there's a lot of depression in the family, a lot of ongoing stressors, or a lack of social support. But otherwise, the trauma-focused CBT is really the best bet. And this is something that providers can be, if they are not already trained in trauma-focused CBT, there is a national training program which is free to certify therapists in trauma-focused CBT. So if you are trying to build or enhance the the facilities available in your community post-disaster, you can encourage counselors, therapists to take advantage of the free training for trauma-focused CBT, which can be useful for referrals for the more chronically distressed youth. So now, finally, in closing, I just want to go back to the disaster timeline again. So we've gone through the early recovery and the late recovery kinds of interventions, and I just want to point out briefly before the disaster occurs, or the preparedness period. And I just want to say that this is another area where communities can get involved, because it's helpful if you can teach families to navigate some of the pre-disaster stressors that they may encounter. And you can do this by helping families to develop a family disaster plan, which is also covered in the Youth Strong Manual, and also help them identify, if needed, evacuation options, enhance family communication, and use some of the strategies in the level 1 of Youth Strong teach those, because they're also good stress management strategies, like the relaxation and deep breathing, for example. So with that in mind, I would just like to say we post pretty regularly on Facebook, Instagram, and on my Youth Risk and Resilience Lab. And also Serendipity has a number of materials. So I would be delighted if any of you decide to follow us on Facebook or Instagram. Just by illustration, there's some of the postings that we do. We try to post about resilience and coping and tips for staying healthy and fit, some of the things we've just gone through in the Youth Strong Manual, and put them in user-friendly and child-friendly materials. So we would be delighted for you to follow us there. So meanwhile, thank you for your time and attention, and I'm going to open things up for questions. So let me get out of this sharing mode and see where we're at. So thank you for your time and attention.
So Annette, we have one question in the chat
Okay.
centered around the TFCBT. Could non-counselors take this class just for the info to help as we communicate with our trauma-impacted students?
That's a great question. I think that it may be available to those, even of those who are not like licensed counselors or mental health workers. I would go to the Trauma Focused CBT website and check that out. But it's generally freely available, and I think it's something that is worth taking a look at. I may I'll look through my materials after we talk, and if I have something more specific I may have a copy of a manual or something that can be shared. So let me make a note about that, and I'll get back to you on the trauma focused CBT.
And we have another question in the chat. Can you please show the slide to download the book again?
Sure, the slide to download the book. Let's see. Back to the share. Okay. You can always download the book at this faculty website, Youth Risk and Resilience Lab, or also Serendipity. Those are both easy ways to get to the manual. You know, quite frankly, all you have to type into Google is Annette LaGreca Lab, and you'll get to that website. That might be an easier way to remember it. Just Annette LaGreca website or lab, and my website for the lab comes up.
And also, Beth and Quentin, I don't remember if we sent you all a copy of the book, a PDF, but we can send that to you, which if you want, you can distribute that out to all the folks within the network.
Yeah, that would be great. So we can distribute it out. We can also, when we put the recording on our Google site, we can attach that as well, so it's accessible from there.
Hmm.
And if anyone wants hard copies, we worked with Kentucky 4-H in the extension program to print some hard copies. So contact your local 4-H representative in your community, and if they don't have hard copies, they should be able to get them from the state folks. Are there any other questions, comments?
Okay. Okay. Well, thank you for your time. I really appreciate it. You know, I think, we're all concerned about the rise in these kinds of events. And so any skills that you can develop to help youth cope and as Scott pointed out, they're good for adults too. So, um, hopefully this information will be useful for you going forward.
Thank you very much. It's been our pleasure.
Yeah. Thank you.